Got Dr. Sutton back with us. We talked at the beginning of the show Inside Out 2 and anxiety and that representation, but you've actually got some concerning things for seniors and how it can impact
What does anxiety look like when we're older adults, and what effect does that have? So in this new study, they looked at those who lived with anxiety, older adults between the ages of 60, 70, 80, and they found that those who lived with chronic anxiety had in some cases a 4-fold increase in their risk of dementia within 5 years. It just speaks to the fact that anxiety is more than just the feeling of being uncomfortable. It can translate to negative effects in our brain and our overall health if we leave it untreated.
So what can we do to reduce our anxiety?
I think number one, acknowledging it, recognizing it. That's why I think movies like Inside Out 2 are so important to help and helpful for even those who are living with anxiety to realize what anxiety looks like. And then beyond that, self-treatment can start with simple things like making sure that you're journaling because that can help get your thoughts on page and away from your thoughts. Physical exercise is a natural stress reducer, focusing on sleep, and then also just in general, making sure you're maintaining a healthy diet, visualization techniques, meditation, these are all incredibly helpful.
What if it's a family member that you're worried about?
I think having open and honest conversations, treating anxiety as a diagnosis instead of something that is a moral failure. That's not something that someone can choose to do. Realizing that we can treat anxiety the same way we look at things like diabetes or high blood pressure. Looking at it as a disease separate from that person's choices, I think is the first step to avoiding stigma.
Is there anything that you could say, and I mean, I think there might be an assumption that a person who's a senior citizen just is who they are going to be.
Yeah.
And how do you get them to maybe change those patterns of behavior?
That's such a great point. And studies show that you can change behavior if you work at it. I think a lot of the times we normalize these experiences and say that's just how grandma or grandpa is. But grandma and grandpa can still learn new things. They can still treat themselves. And so I think focusing on the fact that we can all change and be better, regardless of what age we are.
Yes, very good to know. And for chronically anxious anchors, too.